Well, hi, folks. Mr. Bleecker here. Now that we've done our introduction to the body systems and we've looked at the four basic tissue types, we're going to start out with the reproductive system. Part one will focus on female structures and the female reproductive cycle, and part two will focus on the male. Okay? In this case, what will be a little bit different, I'll give you the notes in their complete form, and we'll use those notes as basically as a narrative, as a guide for the lesson. So I'm going to get going with that. And here we go. So, reproduction is really all about the next generation, right? You might look like your father, you might look like your mother, but you're in fact a new combination. And it's very important, and it keeps essentially a genetic shuffling of the deck going on at a sort of a constant level. It maintains the health of populations. Fundamental anatomical differences are fairly obvious, right? The male reproductive structures that produce sex cells are the testes, producing sperm, and the female reproductive system, the counterpart is the ovaries, which produce eggs. But there's a lot more we have to look at here. It's highlighted in red. We'll look at hormonal regulation, and in the female's case, we're going to look in a fair amount of detail at the uterine cycle. Of course, fertilization, pregnancy, and then there's a final topic that I'll go into, which is really about focuses in on control over reproduction, right, and fertility issues. Okay, now a lot of writing here, so I think what I'd rather focus in on is this diagram right here. So about the time that you hit puberty, this really gets going. And it's what we call a feedback loop. Now this is the hypothalamus. Oh, let's just move that down a little bit. The hypothalamus you can think of as controlling all the hormones. And in fact, it's connected by a series of cells. You can think of them almost as wires to this guy down here, which is called the pituitary gland. Now, you might have heard of the endocrine system, your hormonal system. And your reproductive system and your endocrine system will work together. I'm going to focus a little bit more on talking about the reproductive system, but of course, you'll hear me talking about hormones here, and that is, of course, by nature endocrine. So we're kind of talking about both. Your pituitary gland is literally made up of two parts, anterior and posterior. So here's your anterior, which I'll just highlight here, and your posterior behind it. So you can think of it as having two lobes because that's accurate. So I referred to puberty. So a great number of changes, of course, occur at puberty. Secondary sexual characteristics are expressed. Men get facial hair, wider jaws, deep voices, right? Females, the hips begin to widen. Of course, there's the addition of pubic hair, hair under the arms, hair on the legs, and things like that. But what I want to focus in on is kind of how it all gets started, how this ball gets rolling. Around the time of puberty, the hypothalamus is going to send out even greater signals here. You'll see something there mentioned as GnRH, and that is gonadotropic there we go, gonadotropic releasing hormone. Okay, basically what GnRH stands for. There we go. Now, gonadotropic releasing hormone, the hypothalamus is going to send a hormonal signal down to your anterior pituitary, right down here. And it uses your cardiovascular system to do it. You'll notice that the hypothalamus is awfully close to the pituitary. Well, it's the hypothalamus is in control, so it's going to basically issue orders to your anterior pituitary gland. Move that up a little bit. So your anterior pituitary gland, about the time, especially around puberty, you're going to get a sudden release of a couple of really interesting hormones. Okay. Now, the first one I'd like to mention is this one over here called follicle stimulating hormone. And it does exactly what it says. It stimulates the cells in the reproductive tissue to produce either egg or sperm. Now, it's you've probably heard follicle associated with eggs. As they develop, they'll release an egg from a follicle. That's true, but in the male sense, follicle stimulating hormone will encourage the production of sperm. I'll just write that as an abbreviation. Okay, there you go. So the anterior pituitary can send down a couple of important hormones. One, of course, being FSH, which gets egg and sperm being produced. A second hormone that can be released is called luteinizing hormone. What's different about luteinizing hormone is it is not interested in producing sex cells. Luteinizing hormone is one that will cause a spike in males of testosterone. And in females, you'll see the production of other hormones, such as estrogen and progesterone. And it's these hormones that are responsible for your sexual characteristics. Men have a deeper voice because of testosterone. It thickens the uh, basically your larynx, and we'll get what's called an Adam's apple as a result. Testosterone has additional effects where males on average are about 1/3 stronger than females because it stimulates muscle tissue, makes males more aggressive. Now it's if you think about the tissue that's in the testes and the tissue that's in the ovaries, not all of that tissue produces egg or sperm. There's tissue in between. So we refer to the tissue in between as interstitial. And those additional cells are producing these hormones that produce your secondary sexual characteristics. Right? So in females, your estrogen and progesterone will bring out your secondary sexual characteristics, right? That's why females will have wider hips. Males don't have these hormones, so we don't experience those differences in basically in our physical development. Those hormones there will help develop breast tissue in females. That doesn't happen in males because our interstitial cells are producing testosterone, which has different effects, and vice versa. If females did receive testosterone, they would start to get secondary sexual characteristics like that of males: greater strength, cause the jaw to widen as the cartilage. But where if you've ever seen somebody with a cleft chin, that cartilage is stimulated to grow and divide, and males will have a nice wide chin. If you think of Tom Selleck, for example, that's a sort of a stock example. Big rocky chin, right? Absolutely. So this feedback loop that we're looking at here is very important because it takes the hypothalamus to get the ball rolling with gonadotropic releasing hormone, and once it's sending that signal, the anterior pituitary gland will send down these signals to testes and ovaries to start to produce these sexual hormones. Now, these ones that we're looking at either release or tell sex cells to advance, or additional hormones to be produced like testosterone and estrogen and progesterone from basically from the interstitial tissues. Okay, so this slide introduces kind of all of that information, but let's pause for a moment, right? And we're going to focus more exclusively on the female aspect of this. So I wanted to go to that, and just have it done. I want to go back to the basic female anatomy. There we go. So the ovaries, of course, here's a side profile. They're not actually connected. If we go to the second picture, you'll see this. They're not connected to these things called the fallopian tubes. The fallopian tubes, right at the tip here, have but look, almost like a broom-like structure that wafts over the ovary and will get the egg once it is released during ovulation, about day 14 of the female reproductive cycle. Look at this from side profile. It shows it a little bit better here. Now these are called the, if we go to the this view right here, I want to go back one. Actually, just a second. This will do. These are called the horns of the uterus. You look at the uterus, it's an interesting analogy, where this would almost like be the head of a bull and the horns going up on the side like that. So that's the uterus right there. That's where the baby develops, right? Often you'll hear they talk about the baby develops in mommy's tummy, and that's really a misnomer. That's not actually what's happening. This is actually developing in the pelvic region down here. So, fertilization happens, of course, through the vagina. The sperm cells have to travel through a region right here called the cervix. And the cervix itself is where the baby will be delivered through, and it has to be dilated to about 10 centimeters before a mother's ready to give birth. Also have to consider in female anatomy the breast tissue, which produces lactose. So when we're born, that's the most important sugar. It's a disaccharide, but additionally, it's not just that energy that comes from lactose. It's also in breast milk. What you'll also find are antibodies, and that's important to children because the mother's immune system is the most experienced, and when she produces antibodies against all these germs and organisms that her immune system knows, the baby can consume that in breast milk, and that gives a child a fighting chance as their immune system is developing. So that's a good little overview. There we go. Hit done. This is kind of important because it's called oogenesis, and it's the development of the eggs. The eggs are going from their immature stage here, and we're getting towards the actual egg that is well developed enough to release its payload right here, which is the sex cell. That's the actual haploid cell right there. So germ cells are stimulated over time and they ripen, and we're getting primary oocytes. Secondary, they're getting a little bit more prepared until we get to the time of ovulation, and that's going to be the successful candidate there. We'll come back to that in just a second, but this one I find this one's very important. Now, in the development of as female menstruation progresses, on day one, what we should consider is that a woman has just had her period. So she's at the very beginning of her cycle. Now you'll notice in the middle, focus right here, day 14 is the point at which, on average, ovulation occurs. Now there's some misunderstanding about ovulation. Some people think that only one egg is released from one of the ovaries per month. Well, that's not necessarily true. If you think about twins, more than one egg can actually get fertilized. And it turns out that women can ovulate more than once per month. It's not always on day 14. And it's not like the ovaries take turns. It's not that simple. It's a little more complicated than that. But for the purposes of example, when you teach about the menstrual cycle, you just keep it simple and you talk about day 14 as the average menstruation date, or sorry, average ovulation date, and that's probably a simplified way to go about it. So, in our previous diagram, we talked about luteinizing hormone and follicle stimulating hormone. Okay. Now let's progress from day one. Up here, what you focus in on is you've got a primary follicle, and that has an egg in it. And let's say this is the candidate in the ovaries that's going to release its payload. So as we go to day two, you notice it's developing a little bit, and we're in what's called the follicular phase. The follicular phase is where the follicle starts to advance. So we'll go a couple of days into the cycle, drag to about day 5, for example. And we could see this follicle developing, it's growing, and usually on average it's one egg that's going to advance to the point where it is going to be the one that's going to be released. There's day 9, day 10, and there you can see it. As it begins to develop, it will get near the edge and it literally will erupt from the surface of the ovary. And the fimbriae right here, their job, it's like a catcher's mitt. It's their job to waft over, almost like a gentle sort of like finger like wafting to pick up this egg when it's released. So at this point, follicle stimulating hormone is increasing. And what's going on is that a lot of estrogen is going to start to be secreted right here. Now, we've seen the advance. This is starting to secrete a bit more estrogen into the bloodstream. And I'm just going to back up for 1 second because we've been looking at the follicle. But now, as the estrogen levels rise, let's see if I can move this back. Let's focus now from the beginning cycle, just back up a bit. And this is some residual blood because the woman's mens has just happened. Focus on the uterine lining here. Look at the uterus and watch now how as we get towards day 14, that lining begins to thicken. As the estrogen levels rise, that lining becomes thicker and thicker and thicker. And we're on day 12 now, and you could see the effect of secreted estrogen from the ovary has stimulated the ovarian wall to thicken. And that's because it's anticipating that an egg is coming. And if the egg gets fertilized, the ovarian wall needs to be ready to receive it because the egg will implant into the wall and developing organism could ensue. Now look on day 13. You see this is sort of like the maximum estrogen spike, right? It's huge. Well, why? Because trying to build up the uterine lining, okay? And right here, this is basically the entrance here. This is the cervix. So it's at its maximum thickness. At this point, on day 14, there we go. There's the egg being released, and what's left behind here begins to degenerate, but it's got an interesting role. Oops, lost day 14. This is called a corpus luteum. So we're at the end of our follicular phase on day 14. You'll notice that this is also the maximum of the follicle stimulating hormone. Well, follicle stimulating hormone has done its job. The red line, FSH, rises because, well, we've done everything we can to stimulate the follicle. From this point on, it's all about trying to see if that egg will implant. Now, I wish I could turn off a few of these lines. Luteinizing hormone, and you remember that's one, luteinizing hormone will increase the secretion of estrogen, and it's luteinizing hormone that's told this ovary to crank out these high levels of estrogen. So that's the reason your estrogen levels spike, and because luteinizing hormone has told estrogen to has told the interstitial cells to produce the maximum amount of estrogen, it's also done its job. Okay, so at this point, the estrogen levels will trail off, and that's in sync with luteinizing hormone. So what takes over now is, well, the egg, here's a little arrow. The egg's going to travel through the fallopian tube. Now there's cilia in the fallopian tube, and right about here. Fertility usually happens here, where sperm would be transferred up, and often an egg will be fertilized here, and once it gets to this point, tumbles into the uterus. The point is that it tries to implant. But this corpus luteum, okay, this sort of secondary body here, has a very, very important role. Okay, so we'll go to day 16. Please focus now on the yellow line. That is progesterone. The corpus luteum itself, it kind of has a very interesting job. It contained this egg, okay? Its whole purpose was this egg. This egg needs to be fertilized. So if you kind of think about it this way, I'll personify this. This corpus luteum does not want another egg to be released. Okay, that's a sort of a personification of the event, but the corpus luteum is going to secrete progesterone. And there you go. Now, progesterone right here, what it will do is it prevents another follicular phase. So until this egg has run its course, we're going to be in the luteal phase. See, this thing's called a luteum. So here's the name, luteal phase. So as the corpus luteum is still vital, because it when it dies it becomes it becomes like scar tissue in the ovary. It is secreting as much progesterone as it can, and this is kind of the peak of it. So now you can see the position of the egg. Let's say it's right about here, and the corpus luteum is keeping any more eggs from advancing. But all things must end, and the luteal phase trails off. And you can see how this thing is starting to degenerate, right? The corpus luteum is almost done. So when it's done, progesterone levels will dive. So if you think about the role of progesterone, one of the reasons you'll find it in birth control pills is it prevents another egg from advancing. It's a hormonal way to keep another egg from advancing, so a woman would not ovulate. So you can see how important progesterone is in a birth control pill. By the time we hit the day 26, you get into the secretory phase. So the line, luteal phase right here, and you start to enter the secretory phase, where actually secretory phase, you have your luteal phase. The secretory phase is about the point at which the endometrial lining here, or the uterine line, I should say, is going to be shed. If the egg cannot implant into this highly secretory body, right? This is basically, to borrow an analogy, is like ripe fruit. The egg, if it implants on this, will have all the blood vessels nearby that it needs to get its nutrients from. So you're going to hit the end of the secretory phase by day 28. And at that point, woman begins to go into her menstrual cycle, and this thickened lining will be shed because the egg never implanted. Interesting. It's a great animation. From start to finish, hormone levels rise to get the uterus ready. Egg is released at day 14, right? Follicular phase ends. Okay. This has been proliferating. Okay. Day 15, you'll see this is where the proliferation of the uterus, really it's reached max density. Now it's in the secretory phase and is hoping that egg will implant. The corpus luteum keeps another egg from maturing. Secretory phase begins to come to its conclusion. And when the corpus luteum no longer can hold another egg at bay, we go back to day 1. And another follicle gets its opportunity, and estrogen levels begin to rise, and LH levels begin to rise again. So that's the menstrual cycle in a nutshell. It's quite a long topic. It's something you would want to review several times. The graph on the website right here literally shows the exact same thing. It's why I put this here. Okay, so this is going to be sort of the end of part 1. Part 2 looks a little bit more at female anatomy and moves into just a few explanations about how the birth control pill works and other things. Thanks.